Good morning. I'm Ashley Clara James. I'm a second year medical student. Today I'm going to conduct an complete eye examination on you. Are you okay with it?
Okay.
Shall I proceed?
Okay.
May I know your name and age, please?
Philip Thomas, 45 years.
Okay. Now we are going to check the visual acuity test. For that, please read the smallest line possible which you can see. And please, with this card, please cover one of your eye.
D, E, F, P, O, T, E, C.
Okay, great. And with the other eye, close the other. Okay.
D, E, F, P, O, T, E, C.
Okay. Now I'm going to check your near vision. For that, please read the first two sentences.
There are 26 letters in English alphabet. The circled letters in the above box are A, I, O, U. They are called vowels.
Okay, that's enough. Next, I'm going to perform a visual field test on you. That is static wiggle test. For that, I'm going to place my hand 2 feet apart from your lateral ears. Tell me when you can see my hand. So for that, please go close one of your eye.
Yeah,
Yeah.
you can see. I can see them. Yeah, I can see. Yeah, I can see.
Next, I'm going to test your, have a clean look at your eyebrows, eyelids. For that, I'm going to. In the eyebrows, no scaliness is found, proper hair distribution. And in the eyelids, no lacrimal, no edema, no lacrimal swelling, no edema, and no lesions can be found. Now I'm going to have a clear look on your conjunctiva and sclera. Look up, down, right, left. Okay. Now I'm going to have a clear look on your cornea and lens. For this, I have to use the oblique lighting. No abrasions, no opacities,
No, nothing.
no shadow can be seen in the iris. Now I'm going to have a clear look on your pupils. For that, you may have to turn from the temporal side. Normal size of the pupil and normal size and symmetry, and I can see consensual reaction. Next, I'm going to perform a lid-lag test on you. For that, you may have to follow the tip of the pencil. Please don't move your head, okay? Now we are going to see how is a pupil going to accommodate. For that, please look into the pencil and to the wall. Okay, when I say, look into the pencil and to the wall, pencil, wall, pencil, wall. Okay. Now I'm going to have a clear look on your extraocular muscles. For that, please follow my hand. Okay. For the next examination, that is ophthalmoscopic examination, I'm going to use the ophthalmoscope. Please look straight. Philip Thomas, your eye examination is normal. Thank you for your cooperation.
Thank you.
Let's sanitize our hand before starting the procedure. Good morning. My name is Aishwarya and I'm second year medical student. May I know your name and age?
My name is Krishnendu and my age is 21.
Okay. Do I have your consent for your examination today?
Yes.
Okay. Let's start the procedure.
Okay.
Firstly, let's start by inspecting the auricle and the external ear. After inspection, there are no swelling or bulging or no inflammation. Behind, the mastoid is clear and proper in size. The tragus is clear. Now let's check the inner ear using the otoscope. I'll be inserting the otoscope inside your ear. If you're feeling uncomfortable at any moment, just let me know, okay?
Okay.
Pull the ear up and back. Insert the otoscope inside the ear and then on the light. Pars tensa is proper. Pars flaccida is proper. Cone of light is properly seen. There are no more abnormalities found. Now we'll be doing the whisper test. I'll be obstructing one of your ear and then I'll be whispering few words there or letters on the other side. You have to repeat whatever I say.
Okay.
Okay.
F G Z H.
Now let's do the hearing test. First, let's do the Weber's test. I'll be striking it, the tuning fork and placing it on the middle of your forehead. Just tell me if you can hear sounds equally on both the sides or slightly more on one ear or something like that, okay?
Okay.
Can you hear it equally on both the sides?
Yeah, both sides.
Okay. Now let's do the Rene test. I'll be striking it and then placing it on the mastoid. Just let me know when you stop hearing it, okay?
Okay. Now. Now.
Okay, thank you. Today I'll be examining your nose and nasal passage. Firstly, I'll be looking at your nose and then I'll be putting the speculum inside your nose and I'll be inserting the pen light inside your nose and check if there are any abnormalities in your sinus. Is that okay with you?
Okay.
Just make sure you're looking forward at me. I'll be checking the symmetry of your nose and if there are any deformalities, okay?
Okay.
Is it hurting?
No.
Okay. Now let's check if there is no obstruction. So press one of your nose and breathe on the other side. On the other side as well. Now I'll be inserting the speculum inside your nose. If you're feeling any discomfortable, just let me know, okay?
Okay.
Just put your head backward. There is no redness, there is no crusting, there is no sign of polyp and there are no abnormalities.
Okay.
Okay, to examine the sinus, I'll be pressing my thumb under your eyebrows and I'll be going up and down. Are you feeling any discomfort?
No.
Okay, now let's check the maxillary sinus. I'll be pressing my thumb on the cheekbone and I'll be going in and upwards. Are you feeling any discomfort?
No.
Okay, that's good. So for the next part of the examination, I'm going to turn off the light and illuminate the sinus to check the abnormalities and fluid. For that, I'll be placing the pen light under the eyebrows and then cupping my hands and check for the redness in the frontal area. Okay. Now for the maxillary sinus, I'm going to place the pen light on the cheekbone below the eye and then check for the reddish glow. It indicates the air filled. Okay. Thank you.
Good afternoon, I am Akshya, one of the second year medical student. Today I am going to examine your mouth and the oropharynx. So before that, may I check your name and age please?
I am Andrew and I am 24.
Oh, hello Andrew. Before getting into the exam, can I ask you some questions? Do you wear any dentures?
No.
Okay, fine. Can you remove your mask?
Yes.
So first I'm going to examine your outer lip. I'm going to see the color, symmetry and the moisture. Everything is so normal. I'm going to check your gingiva and palpate for any nodules or ulcer. Could you please open your mouth? I'm going to check for your oral mucosa. So I'm going to look your oral mucosa color and also for any inflammations or any nodules. I found none, which is clear. And also now I'm going to look for your hard palate. Can you depress your tongue? Yeah. And I'm going to take a note on your teeth, your gums, and the interdental papillae. I'm going to check. Please open your mouth, please. I'm going to check for your teeth. Yeah, it's beautiful. So now I'm going to check for the uvula, which is deep. So can you depress your tongue a little bit? So I'm going to check for the uvula, which there is in midline and it is in symmetry. So now I'm also going to look for your tonsils and your oropharynx. If there is any inflammation, everything is so perfect and beautiful. So now I'm going to impact your tongue. Can you put your tongue outside? Like really outside. So I'm going to check for any planks or any. So your tongue is nice and beautiful. So now I'm going to palpate it. I'm going to check on sides of your tongue, both sides, which is clear, and there is no white marks or white planks. So thank you. Hi, I'm Akshay. I'm one of the second year medical student. Can I have your name and age, please?
My name is Kalimuthu,
Yeah.
age 57.
Okay. Hi, Kalmuthu.
Hi.
Today I'm going to examine your posterior chest wall. I'm going to inspect it and I'm going to palpate it and I'm going to auscultate for any abnormal sounds. Are you okay with it?
Yes.
Okay. So I already checked his respiratory rate, which is so normal, is around 20 to 21 respiration per minute. So now I'm going to look for your chest wall. I'm going to inspect it and I'm looking any asymmetry and any muscle abnormalities or any lesions over the chest wall, which is so clear, and I'm not seeing any abnormalities in your posterior back.
Yes.
So could you say if there is any pain while I'm palpating it?
Yes.
So I'm checking for any tenderness. Do you feel pain?
No.
I'm also inspect his thorax expansion. Can you do? Can you do deep breathing in and breathe out? Yes, his expansion, thoracic expansion is far more normal. Thank you. Yeah, thank you. And could you say 99 over the time?
Yes. 99.
Little more louder.
99.
Yeah, great. Thank you. Now I'm gonna focus your back and look for any dullness or it is a normal resonant sound. So now I'm gonna auscultate your posterior and gonna look your breath sounds.
Yes.
I need you to take deeper inspiration and expiration.
Okay.
Inspire. Expire. Sir, I need you to say 99 in louder voice.
Okay. 99. 99. 99. 99.
Sir, could you whisper trust and don't stop until I say so?
Yes.
Yeah. Trust. Okay, sir, you can stop now. You have a normal resonant sound at your posterior back and you have no dullness, and I didn't found any consolidation over your posterior chest wall. You have absolutely fine posterior chest wall and posterior lung function.
Hello, my name is Rajat Maheshwari and today I'll be performing your neck, thyroid, JVP and heart examination.
Okay.
So before we start, may I know your name and age?
I'm Devan Shadam. I'm 21.
Okay, so let's start. First by sanitizing our hands. Okay, So for the examination of your neck, it would require me to palpate and feel around your neck. Would that be okay?
Yes.
Okay. So before we start, I need to check for symmetry, any masses or scars or any submandibular or enlargement of submandibular or carotid gland. Okay, all looks good. Now I'll be palpating your lymph nodes from the pad of my middle finger and index finger, and at the same time moving the skin from underlying tissues or in every area. Okay, so now I'll be palpating your lymph nodes starting from pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental. Okay, so now we'll look for your supra-cervical nodes, superficial cervical nodes, and your posterior cervical nodes. Superficial cervical nodes, posterior cervical nodes. Okay, so taking your trachea for any deviations. To do this, I need you to lift your neck a little bit up and backwards. Okay, so now I'll be placing my fingers across on the both sides of the trachea, and then I'll be noting these space between the trachea and the sternocleidomastoid. While comparing them, they both should be same at the other end. Okay, so all looks good. Thank you. Now we'll do your thyroid examination. So now we'll be starting with our thyroid examination. For this, I need to first inspect your neck.
Okay.
Alright, so now I need you to tip your neck a little bit back so that I can inspect the cricoid cartilage and below it. Okay, so now for our next step, I need you to tip your neck a little bit backwards and take a sip of water.
Okay.
And stop. So tip your neck backwards. Okay, and we can see that while swallowing, the thyroid gland, the cartilage, and the cricoid cartilage all rise up. Now I'll be inspecting the isthmus, which lies from the second tracheal ring to fourth tracheal ring. This is our second tracheal ring to our fourth tracheal ring. Okay, so we'll be palpating the left and the right lobes. But with this, this will help us observe for any nodules, enlargement of the lobes, or any tenderness. Okay, nothing as such happens. So next examination we'll be doing JVP. Okay, thank you. So now we'll be starting with the examination of JVP. For this, I'll be standing at the right side of the patient, and I've asked the patient to lay supine and raise the trunk at 30 degrees angle. So for this, can you please turn your head to the left side? Okay. Now I'll be flashing a light at an oblique angle to identify the venous pulsation. So now I'll be checking the JVP of the patient. For this, I'll firstly find the sternal angle or the angle of Lewis. Which is over here. Okay. Then, so now I'll measure the oscillation point of pulsation of right jugular vein through two rulers and the following techniques. First, by extending a rectangular object such as ruler from the meniscus point of pulsation, and the another ruler extending from the sternal angle. And the another ruler extending from the sternal angle, which will be making a right angle. Clearly showing the vertical and the horizontal lines. So now I'll be palpating both the carotid arteries. For this, I'll palpate above the sternocleidomastoid base. But I have to make sure that I do not palpate both the carotid artery at one time. carotid artery. Right here. So now I'll inspect and palpate the precordium. For that, first I'll locate the apical bead. After locating the apical bead, then I'll be noting its amplitude, how high or low it is, its rate, how fast or slow it is, and its rhythm, if it's regular or irregular. Then I'll be palpating for the heaves, thrills, and the lifts. For this, I'll place my hand against the chest wall, which means I'll be placing my hand at the right second intercostal space, the left second intercostal, the sternal area, at the apex. So now I'll palpate for the strills, and for doing this I'll be doing the similar procedure, in which I'll press the ball of my hand on the chest wall to hear the vibrating or the buzzing sound. Which is a representative for the underlying turbulent forces. So now I'll be palpating for the S1 and S2 sounds. For the S1 sound, I'll be placing my right hand on the apex and the left hand on the carotid artery. After that, the carotid upflow follows the S1, and the S2 lies just after the carotid upflow. Now I'll be auscultating the precordium. For this, I will first note the heart rate and the rhythm. After noting the regularities and irregularities in the heartbeat, now I'll be auscultating the 4 primary points in the anterior chest wall. Now I'll be identifying the S1 and S2 sound. To do so, I'll be placing the diaphragm of my stethoscope on the apex of the heart, and then I'll be placing my left hand on the carotid arteries. As the carotid upstroke corresponds to S1, and the S2 lies just after the carotid upstroke, which is the second sound. Now I'll be listening to the splitting of the S2. For this, I'll ask the patient to take long deep breaths and listen to the apex of the heart until the end of the inspiration. So when I say, please take a deep breath. Now. I'll have the patient turn to left lateral decubital side so that I can hear the sounds from the apex beat. So can you please turn to your left?
Okay. Like this?
Yes. Okay. We hear the S3 sounds in early or mid diastole, while we hear S4 sounds right before the S1. Now I'll be hearing the systolic and diastolic murmurs. With this, we are done with all your neck, thyroid, JVP and heart examination. Thank you.
Hello, myself Osce Patnaik. I'm a second year medical student. Can I know your name and age, please?
I am Pradhan Jyotirmay and I am 24 years old.
Okay, so today I have been asked to perform a complete abdominal examination on you. Is it fine with you?
Yes.
Okay, so before starting, I will sanitize my hand properly. Okay, so I want you to lie down on the bed for me. Is it okay?
Yes.
Shall we start?
Yes.
Sir, can you please lie down and relax yourself? And may I ask you to remove your t-shirt?
Okay.
To inspect the abdomen. So the symmetry of the abdomen looks fine. Then the abdomen is flat and there is visible pulsation at the epigastric region. Then the umbilical area looks fine. There is no rashes and no scars also. There is no dilated superficial blood vessels also seen. So this is normal. So now I will go for auscultation of the abdomen. I will auscultate quadrants. I can hear the normal bowel sound and there are no bruits present, which is normal. Now I'll auscultate the aorta, iliac artery and femoral artery. Everything seems fine now. Now I'll go for percussion. Okay, now continue to stay calm. I'll go for palpation now. Tell me, please let me know if you feel any tenderness. Okay. Sir, please can you take some slow deep breaths for me? Okay, try to relax. Please can you flex your knees for me? Thank you. Now I'll go for deep palpation. Can you please cough? Do you feel any kind of pain?
No.
Okay. Let me know if you feel any pain or tenderness when I release my hand.
No.
Okay. Now I'll go for percussion of span of the liver. I will start by locating the mid-clavicular line. I will percuss starting from down of the umbilicus. Now I will percuss from starting the nipple line to locate for the upper edge of the liver. Now I'm going to measure. So the liver span measured is normal. So now I'll go for palpation of the liver. I'll place my left hand in the lower thorax and then place my right hand in the right upper quadrant. Can you please take deep breaths for me? So now I'll go for the hooking technique. I'll go up to the coastal margin. Please can you take deep breaths for me? Okay, so I can feel your liver, which is normal. So now I'm going for palpation of the spleen. Please be comfortable. Okay, I'm going to support your posterior lower rib cage. I'm going to lift it up. Can you please breathe in aloud? Okay. Take a deep breath for me. Okay, relax. Can you please turn over this side? Now I'll go for percussion to detect for splenomegaly. Okay, I'll start from the 6th rib. Go up to coastal margin and check for the dropped space. Okay, the size of the spleen is normal and the percussion is tympanitic, which is also normal. Now I'll go for palpation of the kidney. I'll try to palpate the left kidney. Relax. I will place my right hand posterior to the 12th rib. Okay.
coastal margin. Try to, can you please take a deep breath for me? Okay, release the breath. Now please try to hold the breath. Okay. Now I'll try to palpate the right kidney. I'll do the same procedure like before. Okay, take a deep breath for me. Release the breath. Hold the breath. Okay. Thank you. Normally the kidney is palpable if the patient is very thin. Now I'm going to examine the aorta. Okay. Take a deep breath for me. Okay, slowly release. Now I'm going to check for the pulsation of the aorta and width. Okay, now I want you to sit up for me, please. Okay, so now I'll assess the costovertebral angle tenderness. There is no tenderness, which is normal. We are almost done. Sir, I want you to lie down again. Relax, thank you. Now I will check for ascites. I'm going to do the shifting dullness technique. Can you please move to the side? Thank you. Okay, relax. Now I'll go for fluid wave technique. I will tap on one flank and try to feel on the other. Okay, for checking appendicitis, I'm going to look for the McBurney's point, which I'll be looking from the umbilicus, and I will just think of an imaginary line up to ASIS, and 2/3 above the ASIS, the McBurney point is located. Do you feel any tenderness?
No.
Do you feel pain?
No.
This indicates the patient doesn't have appendicitis. Now I'll check for so sign. Okay, try to resist my hand, please. Resist against my hand. Do you feel any pain in the abdomen?
No.
Okay. Now I'm going to check for the obturator sign, which is for appendicitis. For this, I'm going to remove the sheet. Is it okay for you?
Okay.
Thank you. I want you to flex your knees and your hips at right angle. Now I'm going to internally rotate the thigh by putting pressure on the obturator muscle. Let me know if you feel any pain on the lower abdomen. Do you feel any pain?
No.
Okay. Relax.
Hello, I'm Devan Shadav. I'm a second year medical student. Could you please confirm your name and age, sir?
My name is Rajat Maheshwari and I'm 23 years old.
Okay, let's first sanitize our hands, sir. Okay, so today I've been asked to examine your shoulder, wrist and hands and motor examination of the upper extremities. So first we'll begin with your shoulder examination. This will mainly involve looking at both your shoulder and assessing their movements. Is it okay with you, sir?
Yes.
So before we begin, do you have any pain in your shoulders?
No.
Okay, for your shoulder examination to start, I would like to request you to please take off your shirts. Is that okay with you, sir?
Yes.
Okay. I'll begin by inspecting shoulder and shoulder girdle anteriorly, scapulae and related muscles posteriorly. There are no signs of swelling, deformities and muscle atrophy. Everything seems normal. Now we'll do palpations. Everything seems normal. Okay, Rajat, now we'll be doing some further movements. So please just copy me, whatever I do. Okay, so put up your hand straight, all the way up. Try to stretch it as much as you can. Okay, now you can relax. Now put your arms back and try to stretch it as much as you can. Okay, now you can relax. Okay, now put your arms to the side and all the way to top. Now you can relax and put your arms crosswards. Okay. Did you feel any pain?
No.
Okay. Okay, Rajat. Now I'm going to put my arm on your back. Could you lift up your left arm? Okay, please, all the way to top. Okay, now you can relax. Okay, please turn. Now we'll assess the range of motion. Now to assess the range of motion, I'll perform some movements of your shoulder girdle. Okay, first is flexion. So please move your arm up in front upwards like this. Take it up all the way up. Okay, you can relax. Now to assess range of motion, I'll perform some movements of your shoulder girdles. So first is flexion. Okay, all the way up. You can relax. Okay, now extension. Okay. You can relax. Now abduction. All the way up. You can relax. Adduction. Okay, you can relax. Now we'll start your wrist and hand examination. For that, first I need to inspect your hands, please. There are no signs of swelling, trauma or muscle atrophy. Now we'll only be inspecting one hand. Now I'll palpate your distal radius and ulnar. Now I'll palpate your styloid bone and anatomical snuff box. If you feel any pain, please tell me.
Sure.
Do you feel any pain? No. Okay. Now I'll palpate over 8 carpal bone lying distal to the wrist joint. Then the metacarpal phalangeal joint. Now I'll compress your MCP joints by squeezing your hand from both my thumbs. Now there is no sign of any bugginess, tenderness and swelling. Now I'll palpate your proximal interphalangeal joints. Now the same process for distal interphalangeal joints. There is no sign for any tenderness swelling. Now we'll assess range of motion of your wrist and hands. So first is flexion. Please turn your palms up. Now turn them all the way to your face. Pull them back. Now all the way down to your toes. Very good. Now we perform adduction and abduction. With your palm down, bring up your wrist like this. Now away and now towards you. Do you feel any pain? Okay. Now I'll perform hand grip strength to check strength of your fingers. Okay, like this. Now squeeze as hard as you can. Okay, very good. Now pull up your thumb in your wrist like this. Okay. Do you feel any pain? Okay, very good. Now we'll test for carpal tunnel syndrome, please. Okay. Do you feel any pain? Now we'll perform tunnel signs. If you feel any sensation or pain in your second, third and finger, let me know. Anything? Now we'll test for fennel sign. Please put up your hands like this. Okay, after 1 minute. Do you feel any pain in your second, third or fourth finger?
No.
Okay. We are done with your wrist and hand examination. Now I'll start your motor examination of your upper extremities. First, I'll check for body posture. Body posture seems fine to me from what I can see. Now, I'll check for involuntary movements like tremors as seen in Parkinson's disease. Now, I'll check for muscle bulk, for muscle size, consistency and atrophy. It seems fine to me. Now, I'll check for muscle tone, that is resistance to passive movement. So, please can you hold your hand freely? It seems fine to me. Now, I'll check for your muscle strength. First, we start by shoulder abduction and adduction. Okay, sir, can you put up your hands like this? Okay, resist me, please. Okay, we perform elbow extension and flexion. So, please close up your fist. Okay. This is normal elbow flexion and extension. So, now you have to resist me. Okay, this is also normal. Now, we'll perform wrist flexion and extension. Okay. This is normal flexion and extension. So now you have to resist me. Okay. Okay. So it's normal. Now we'll perform finger extension. Like this. Okay. This is normal finger extension. So now you have to resist me. Okay. The results are normal. So we are done with your examination.
Good morning, I am Chaudhary Nishkash, second year medicine student. Today I will be examining your knee and motor examination of your lower extremity. Can I confirm your name and age?
That's possible. 49 years old.
Okay. It is a simple test without any discomfort or pain. But then also if you feel so, do let me know. Do I have your consent for the procedure?
Yes.
Thank you. So let's start. Will you lie down here for the procedure?
Yeah.
In a supine position with knee extended, we will check for swelling, erythema, deformities or quadriceps of muscle. Can you flex your knees? And then we will also see for the hollow space of patella. Can you extend your legs? In a supine position with extended leg, we will check for the suprapatellar pouch. That is, we will from the 10 centimeter Above the superior border of patella, we will go like this to check the suprapatellar pouch for tenderness, edema, thickening or warmth. Now can you flex your leg? Like this. Now we will see for the medial meniscus. We will palpate the medial meniscus for the tenderness. If tenderness is there, then it might suggest that we are having a partial tear. Now we will check for medial condyle and medial collateral ligament. And now we will check for lateral meniscus, lateral collateral ligament and lateral condyle in the different leg. This seems normal. Now we will see the range of motion. Can you please stand up for me? Now we will ask patient to flex one of his leg while standing on another. Flex the leg. Okay. Now this leg. Okay. Now extend it here. Okay. Now extend it. Can you please sit at the edge of the bed? Please extend your leg. Thank you. This one. Thank you. Now externally rotate. Now internally rotate this leg. Now externally rotate this leg. Now internally rotate this leg. Thank you. Now we will perform the McMurray test. Please can you lie down there? McMurray test is used to evaluate the meniscus tearing. We will fully flex the leg and then rotate it externally and extending the leg. We will perform this 3 to 4 times. Now for the other medial. Now we will perform in another leg. Thank you. Now we will perform the valgus stress test. For this, we will push the knee inside and the lower leg outside. And for the lateral, okay. Now we will perform the test, Lechman test. On another leg now. Now we will perform the anterior drawer test. We have to flex the knee at 90 degree and have to see the anterior hamstring and then check for the cruciate ligament, is it okay or not. We have to make sure that legs are at 90 degree flexed. Now we will perform the posterior drawer test to check the integrity of posterior cruciate ligament. We will flex the leg and check for the integrity of posterior cruciate ligament, and if we see any jerk in this, then there is something abnormality with the posterior cruciate ligament. Now we will do the motor examination of the lower extremity. For that, we will see in supine position a person is having any involuntary movement like fasciculation, tremors, dyschronia, myoclonus, tics, etc. Now we will look for the muscle bulk. Now we will look for the muscle tone. Now we will check for the muscle strength. We will ask the patient to sit on this chair. Can you please sit on this chair? Can you extend? Now we gonna check the movement of certain joints. For that, we will ask the patient to lie again on bed. Can you please lie on the bed? In a supine position, first we will check for the flexion of hip. For that, I will put my hand on the anterior mid thigh and ask the patient to raise his leg against it. Can you raise it? Okay. Now on another leg. Now we will check for extension of hip. For that, I will put my hand under the posterior mid thigh and ask the patient to bring down his leg against my hand. Now we will check for other leg. Now we will check for the extension of knee. Now we will check for the flexion of knee. Can you hold it here? Now can you do it again and hold it here? Now we will go for the plantar flexion of foot. We will ask the patient to move down his toes against my hand. Can you do it for the other leg also? Now we will go for the dorsiflexion of foot. We will ask the patient to move his toes against my head. Thank you. That's all for our examination. You may stand up. Thank you for your convenience and thank you for your assistance.
This is Dr. Small this side. Today I am going to check your cranial nerves activity.
Yeah, I have to do
Okay. So first of all, yes, I will test your perceptual nerve. You just close your eyes. Can you smell this?
No.
Can you smell this?
Yeah.
Can you smell this from left nose?
No. Yeah, I can.
You can see your olfactory nerve is working all over.
Yeah.
Three reports. There are 5 activities, so we can check your optic nerve. So first is your SINUSES. This is 55 centimeters below. Can you read this? Yes.
Yeah, I can read this. Yeah.
What will
Yeah, it's transition from I can read.
So second is your cology section. Okay. So can you read this color?
Yeah, it's light orange.
Okay. And what this is?
Orange. So it's green. Yeah, I can find it out.
Okay. The third activity is just visual. Then of course it is.
एक दो तीन Just like the one.
3 and 4. 3, 4 and 6. Okay. Just put your hand in stable condition. It should not move. Okay. Just look at this. Look at this side. Without moving the head. Look at this side. Without moving the head. Look at this side. look at this side. Look at this side. And look at this side. Look at this side. Look at this side. Clear about it.
My name is Chaudhary Aditya. We are discussing about cranial nerve, vestibular, cochlear. First, we have to sanitize our hand. First of all, we are going to perform whisper test. Repeat after me. 3, 2, 7, 1. Now again. 3, 2, 7, 1. Now we are performing Rene test. Which side do you hear the most longer?
Both side equally.
Now we are performing Weber test. Which one is loud?
First one.
Which one is loud?
First one.
We are performing glotopharyngeal nerve and vagus nerve. Listen, patient voice hot or does it have a nasal quality? Now we have to check difficulty of swelling or not. Ask patient to ah. Say ah. Uvula and soft palate is normal. Now we are performing gag reflex. First we have to sanitize. Can I use this? Now open your mouth. Your gag reflex is okay. We are performing spinal accessory nerve. There is no atopy in your both shoulder. Please sink your shoulder against my hand. It's normal. Now you have to your mouth against my hand. We are performing hypoglossal nerve. Please say some words. 3, 7, 5, 2, 1. Okay. Please open your mouth. Move your tongue right or left side. Now move your tongue upward and down. There is no atrophy of fasciculation. Movement are normal. Asymmetry, atrophy, aberration from the midline is normal.
Hello, my name is Tanvi Jain. Can I get your name and age, please?
Devan Shadav, I'm 21.
So today I'm going to perform cerebellar function on you. For that, I'll perform some tests. Can I do so?
Yes.
Okay, so first we'll sanitize our hands. So now the first test we are going to perform is the finger, nose, finger test. In that you have to touch my finger, then your nose and again my index finger. And I'll be keep on moving my fingers.
Okay.
So the next test that we are going to perform is the rapid alternating movement. In that you have to pat the palm of your hand on your knees and then the back of your hand.
Okay.
So can you please do so? Faster. Okay. So the next test we are going to perform is the heel to shin test. In this you have to slide down your heel down the anterior tibial surface like this. So can you please do so? From the different leg, from the other leg. Okay. Now I'm going to perform the gait test. For that you need to stand up. Can you please do so?
Okay, sure.
I need you to walk back and forth across the room. So now I want you to walk on your toes like this. Okay. So now I want you to walk on your heel like this. Okay. So now I want you to do tandem walking, which is heel to toe like this.
Okay.
Okay. So now I want you to hop in place with your one leg like this.
Okay.
Okay. Okay. I want you to bend your knee like this. Okay. Now I'm going to perform the Romberg's test. In this, I want you to stand with your feet together and arms by your side like this.
Okay.
Do so. Now I'm going to extend my arms in front and back of the patient like this.
Okay.
Now please close your eyes.
Yeah.
If the patient is able to maintain his posture without any movement, it is a sign of negative Romberg's test. You can open your eyes now.
Okay.
So now I'm going to perform the sensory examination on you. For that, I'll be assessing the pain sensation in your arms, legs and trunk. For that, I'll be using a pin, the sharp end of a pin and the blunt end. So now, can you please close your eyes so that I can perform the test?
Okay.
Okay, so now I'll discard the pin. Temperature testing is done when the pain sensation is abnormal. I have two test tubes with me. One is hot and the other is cold. Can you please close your eyes? Now tell me which one you feel.
Hot. Cold. Hot. Hot.
Okay. Now I'm going to perform the light touch test using a cotton wisp. Now I'm going to touch you with the cotton wisp. Whenever you feel it, please say no.
Okay.
So now I'm going to perform it.
Okay.
Please close your eyes.
Okay. No. No. No.
Okay, thank you. Now I'll be assessing the vibratory sensation using a light frequency low pitch tuning fork. Can you please close your eyes?
Okay.
I will tap the tuning fork at the heel of my hand and then place it against the soft tissue of the patient's finger and the big toe. I will ask the patient how he feels and tell me when the sensation stops. So now I'm going to do the same.
I feel it. I feel it.
Now I'll place the tuning fork nearer to the trunk to see if the sensation has been perceived.
I feel it.
Okay, thank you. Now I will test for the position sense or the proprioception. In this, I will hold the patient's big toe between my thumb and the index finger and I will ask him to identify the direction of motion. Can you please close your eyes and please identify the direction of motion of your toes and your fingers.
Okay.
Please close your eyes.
Down. Up. Down. Up.
So now I'll do the same with the fingers as well. Please tell me the direction of motion.
Okay. Up.
Now I'm going to test for the discriminative sensations, beginning with stereognosis, in which I'll place different objects in your palms and you have to identify.
Okay.
So can you please close your eyes? Place your arm forward. Okay, so I'm going to place the object. Tell me what it is.
Coin.
Okay, very good. Another arm.
Pen.
Okay, very good. So now you can open your eyes. Now I'm going to test graphesthesia. In this, I'll make a number on your hand, on your palm. You have to tell me what number it is.
Okay.
Okay, please close your eyes and place your palm forward.
9.
Very good. Now I will perform 2-point discrimination test. In this test, I'll be using the ends of 2 points, and I will prick the patient's finger pad either simultaneously or with only 1 point occasionally. So can you please close your eyes and tell me either you are being touched with both of them or only one of them.
Okay.
Okay. Please close your eyes. Please give me your finger.
Both. 1.
Next arm.
1. Both.
Okay, open your eyes now. Now I'll reduce the distance between the 2 points so that I can determine the minimum distance at which the patient can identify both the points. Please close your eyes again. Please pull forward your arm.
Both. Both. Both.
Okay. Now I will perform the point localization test. In this, I will place my finger on the patient's skin, and then I'll ask him to open his eyes and point towards the place touched. Can you please close your eyes?
Okay. Here. Here.
Okay. This test helps us in locating the sensory loss in the legs and trunk. Now I'm going to test the double extinction test. In this, I'll use my both fingers and provide a stimulus either in one part of the patient's body or both the areas simultaneously. You have to tell me if it is both or only single.
Okay.
Please close your eyes.
Single. Both. Single.
Okay, you can open your eyes. So thank you very much. So now we are done with your final examination.